Hello, and thank you for joining us for this session on AHA TV. It is my pleasure to be here with you today. I am Sana Al-Khatib. I'm an electrophysiologist at Duke University in Durham, North Carolina. And I am delighted to be joined by my colleague, Dr. Oussama Wazni, who is an electrophysiologist at the Cleveland Clinic. And I would like to start by congratulating you on completing this amazing clinical trial, the OPTION trial.
Thank you, Son.
Of course. Can you please just tell us about the main purpose of the trial and what the main results were?
So the OPTION trial was really about atrial fibrillation ablation patients and what to do for them in terms of stroke reduction. So right now when we do an ablation, patients may continue to have recurrence of AFib.
Yes.
And some of it may be asymptomatic. And then the patients will want to come off anticoagulation. But if they have a high CHA2DS2-VASc score or a high risk of stroke, if we stop anticoagulation and they continue to have AFib, then they may have a stroke. Mm-hmm. On the other hand, if you have a patient who has no recurrence of AFib and we keep them on a blood thinner or an anticoagulant, thinking that we're following the guidelines, the patient may end up with having a major bleed or even just recurrent bleeding. And the guidelines, because there are not too many studies on this subject, they say that we should not even take the result of the ablation into consideration, but rather just the CHA2DS2-VASc score and the stroke of risk.
Very true.
Yeah, so that's why I think OPTION was very important, because we wanted to see if we can find an alternative to oral anticoagulation. And since Watchman was already approved to reduce stroke in patients who bleed, we thought, well, maybe this would be something that would mitigate the guidelines and this uncertainty.
And so you randomize patients to undergoing ablation and continuing oral anticoagulant versus ablation and left atrial appendage occlusion with a Watchman device. And what were the main results?
So the main results we found is that closing the appendage with a Watchman Flex device was actually non-inferior to anticoagulants with respect to all-cause death, stroke, or systemic embolism.
Yep.
I mean, also, even though it's just, we said non-inferior, and there's been a lot of chatter on this, numerically, the number of events were actually less in the Watchman Flex device. And the margin with a minus 0.5%. So that gives us a confidence that it's truly non-inferior. But I think what's even more important is that it was superior to oral anticoagulants with respect to bleeding. I mean, here we're talking about major bleeding or non-major but clinically relevant bleeding. And I think in when I was presenting the results, we didn't spend too much time on what this means, but clinically relevant non-major bleeding means somebody who has to talk to a doctor about the bleeding, go to the hospital or the ER, or even change the management. So it should not be trivialized.
Yes.
And taking these considerations, Watchman Flex was superior to oral anticoagulation.
Yeah, no, I get it. Very intriguing results. Let me ask you, for clinicians, what is your message? How should clinicians apply these results in their own practices?
I think now at least we have a choice. So the doctor and the patient can have a shared decision-making discussion if you want. I mean, we already have to do that when we implant a Watchman device or when we're considering a Watchman device. We already have to do a shared decision dialogue with the patient. And now we can present them with the choice of continue oral anticoagulation or close the appendage and stop anticoagulation. And I think this is an ongoing discussion and something for us to continue to investigate.
Absolutely, and an important point that you brought up and the discussant, Dr. Manesh Patel, during the session brought up, was to make sure that people know that these are patients who underwent atrial fibrillation ablation. So can people generalize those findings to other patients with atrial fibrillation at risk of stroke?
Not yet. So I think the short answer would be not yet. There is a big study called Champion that basically is looking into whether closing the left atrial appendage with the Watchman Flex device is an alternative to oral anticoagulation in patients who have not had an ablation. That study completed enrollment. We're in the follow-up phase. It should be reported on, I think, in 2026. So no, we cannot generalize right now. So right now, I think the way I would take it is in patients who should be on a blood thinner but can't because they're bleeding, closing the appendage with a Watchman device or any other left atrial appendage closure device is actually reasonable because the patients can't take oral anticoagulation. What option does is that for the AFib ablation patient, because it's really a difficult situation.
Yes.
Because patients, sometimes have an ablation thinking that that's their ticket to get off the blood thinner.
Exactly.
A lot of our patients come, like, what do you mean I still have to take
Yeah.
I thought that's
We
why we
have
did
to
the
educate
ablation. It's
them.
like,
Yes,
no,
yes.
we did the ablation for symptom relief, for prevention of heart failure, but there are no studies that have shown consistently that ablation reduces the risk of stroke.
Mm-hmm.
And that was the dilemma. So now at least they have this option, and that's how we do it. So I think, there's still a lot of areas where we can investigate and refine who the patients who would really benefit from this. But I think, again, with a good discussion with the patient, we can find the right people who would benefit from this.
No, absolutely. Oussama, thank you so much for being with us today, and congratulations again to you and the rest of the team on the completion of this important trial. Thank you so much for listening.
Thank you so much, Sana, and I really want to take this opportunity to thank our patients because I don't know if people realize, but the study started November 2019, so right before COVID, and we finished in 2021. So the whole study, we were able to still enroll despite COVID because the patients were really enthusiastic. So there's a lot of interest in this, and we were able to get the study done in the timelines that we had in mind.
That's amazing.
Thank you for having me, and thank you guys for listening. Thank you.
Thank you very much for the opportunity to be with you, and thank you for listening.